okay, right?
Yeah.
Alright, so today we're going to be doing a trach dressing. So first thing I'm going to do is I'm going to walk in the room. So I already read my IPN from the night shift, so we need to do our trach dressing change and change the inner cannula and do some suction. So I checked that, and I'm just going to walk in the room, do my safety check, make sure the patient's bed is in the lowest position, and make sure he's in semi-Fowler's position. So I'm going to raise the head of the bed for him here just so he can breathe a little bit easier. And I'm going to raise the bed up to my height just so that I can do procedure properly. So I'm going to check his name badge just to make sure we're doing the right patient. So check here, Wendy Homes, and the FIN number is correct. So I'm going to put this away. And now I'm going to come in. And so, hi, my name is Carli, and I'm just going to be changing your trach dressing today and doing some suctioning and changing the inner cannula. Is this okay with you? Yes? Okay, great. So I'm going to do my first safety check. So I'm going to come over here, I'm going to make sure that the cold pot is running at the right rate, so which it is, and make sure that the oxygen is turned on. So we have the oxygen turned on so that the patient can breathe there. And then I also have my suction. I will want to turn this on too. I want it to be between 80 and 120. So I'm going to test that in a second. I'm just going to put my gloves and mask on first. For the demo, I'm not going to be wearing a mask, just so that you can hear me better. So I'm going to put my gloves on. I'm going to check the pressure of the suction. So here we go. And that's a little bit high, so I'm just going to turn it down here. Perfect, so it's at 90s, which is between 80 and 120, so we know that this is good. So since this fell on the floor, I would have gotten a new inner cannula. So my second nurse will have come and brought me a new inner cannula. Now I'm just going to do my safety check here. So I'm going to make sure I have all my supplies. So I have my sterile water, and I have my normal saline, I have my ambu bag, and I have my trach dilators. I have my extra trach insert there. We have an inner cannula here, and the trach dilators, extra trach ties, and it looks like we have all of our supplies that we need. So now I'm going to take off these gloves, and I'm going to ask the patient to take some deep breaths for me so that when we're suctioning, that he'll have enough oxygen. So I'm going to just wash my hands here before I start. And so can you take a few deep breaths for me? Great, okay. So he takes a few deep breaths, and I'm going to put some gloves on, and we see that his trach size is, we see that it's 7 here, so then we'll do 7 minus 2 times 2, which is 10, so that's the size of our section. So I have my gloves, he's in semi-Fowler's, so that's good. So we took a few deep breaths. I'm going to turn the oxygen level back to normal, and we would have an O2 sat monitor on him just to ensure that he has the right oxygenation and that he's doing okay. I'm just going to remove this pillow from your head, okay? Alright, and he doesn't have any contradictions to doing that. So I'm just going to remove this, and now I'm going to get my suction. So we said it's a 10 French. I'm going to use sterile technique to open this up, and I'm going to attach my section here. I'm going to attach this here. And I'm going to check the pressure again, so it went down a little bit, so I'm just going to increase the pressure a little bit. And it's at 90 again, so it's good. So I'm going to remove this and put this package away. And maintaining sterility, I'm going to grab, so we have 5 inches, and I'm going to put it into the inner cannula here. And I'm not going to suction as we're going in, but I'm going to go down until I hit the bifurcation, and then I'm going to intermittent suction for less than 10 to 15 seconds as I'm coming out. And if the patient needed more suction, I would get a new new suction tube, and you would do that. So I'm going to remove this with my glove, throw this away, and I'm going to remove this glove too, and I'm going to just rinse this out with my sterile water to clear the tubing of any secretions. And we're checking his oxygen saturation, and it's good. It's at 100%, so it's good. So I cleared the tubing here. I'm just going to hang it back up. Now I'm going to be changing the inner cannula. So I have my inner cannula here. So I'm going to remove the old inner cannula. How are you doing? Are you doing okay? Thumbs up? Okay, great. So I'm going to make sure to stabilize here and remove the old inner cannula. And I'm going to throw this away and just have my garbage can on your bed here, okay? So there we go, removing this one. And then I'm going to open up this new one here. And put on my gloves. And I'm gonna maintain sterility and just grab by the end here and make sure that I don't touch it. So my hand touched this portion, so I would get a new one here. So I have this new one right here. I'm just gonna open it up. And I'm gonna grab the end portion right here. So just like this, just touching the end, and I'm going to insert it in. Good. So that is in and good. And I'm going to remove my gloves. And I'm going to throw these away because they're contaminated there. And now I'm going to get my new set of gloves, and now I'm going to be changing the dressing. So I'm assessing the old dressing, how much mucus and sputum is on there. And right now it looks pretty clean. So I'm going to remove the old dressing here. And I'm assessing the stoma site, so it looks, there's no redness. No edema, it doesn't look like there's any signs of infection. So I remove the old dressing. I'm going to take off my gloves and do some hand hygiene. And I'm going to open up my tray. And I'm just going to adjust this here. I'm going to remove this here. Still fell within the sterile area, so it's okay. So I'm going to throw that away because I don't need it. And I'm going to remove my garbage can as well. My garbage bag. There, and I'm going to put this on the side. The 1-inch border is present there. And I'm going to add my drain sponges. But first I'm just going to move my forceps to the edge here. So there to the 1-inch border. And again to the 1-inch border. And now I'm going to add my drain sponges. Get my forceps. There. And I'm going to add my normal saline for cleaning. And I'm going to be using Q-tips to clean around the top and a 2x2 to be cleaning around the bottom. So I have my Q-tips here. So I'm going to put on my gloves, not turning my back to my sterile field.
So in the event that my IV drain sponge had gotten wet, it's not. I would get a new IV drain sponge and have one over there, and I borrow one.
Open this up, and I'm going to pull out my Q-tips. And I only need one to start, so I'm just going to put this one on the side. Down this one, get it wet. And I'm going to clean around the stoma, so dirtiest, there we go, we go clean to dirty. Or I'm just cleaning around the stoma first, and I'm going to throw this one away. And then I'm going to use a second Q-tip to clean the top here. Good. I'm trying not to move the stoma at all, as we don't want to cause any harm there. And I'm going to get my Q-tips again. cleaning the bottom here. So I'm cleaning the bottom aspect, and I'll throw this away. And then I'm going to
I'm not gonna dry tubing because
clean the bottom again here.
about the skin not getting
There we go. And then I'm going to dry the top.
so I'll move my IV dressing here. I'm gonna get my gel on it out. Washing my
So I'm going to dry the top here closest to the stoma. And then I'm going to dry the top here away from the stoma. And then I'm going to use my Q-tip. I'm going to dry this bottom area here, throw that one away, and then I'm going to dry this area here. And if it still has some mucus on it, then I would get a 2x2. So it looks a little bit dirty still, so I'm just going to grab a 2x2 to clean the area.
So clean all the areas that I was touching with.
I'm gonna dab it. And if any water got on my sterile field, I would get a new one, but no water has, so you know that it's okay and it's still sterile. So now I'm just gonna dry the area.
Apply the IV drain sponges here.
I'm gonna dry this up here. Good, and now I'm going to get my drain sponge here. So I'm going to pick it up from my sterile field with my forceps. And I'm going to only touch the outer aspects, making sure that the center stays sterile. So I'm only touching the sides here.
I do have a 4x4 on my tray that I can use, but I showed IV.
So I'm going to reach across here and put this underneath. And now I'm going to get my forceps just to push it under a little bit more. I'm going to push this here and push this here. And then using my forceps, I'm going to pull this up.
I would date and sign it, as well as the date, time it, and sign it. And I will go ahead and take it
there. And I'm going to pull this up. I want to make sure that there's no folds there that could cause skin breakdown. Alright, so it looks good. It's in place. I'm going to throw these forceps away. And so now the patient, we've done the dressing change. I'm going to reapply the oxygen to the patient and attach it on here. I've been checking his oxygen saturations and they've been at 100 the whole time. So now I'm going to take off my gloves. I'm going to make sure that the patient's in a comfortable position, make sure the bed's in the lowest position, so I'm going to lower the bed back down. I'm going to clean up all my garbage, which I had in the garbage can on the bed there, and then I would exit the room and I would document everything that I've done here, so that I did the trach dressing change, the suctioning, and then the inner cannula tubing change.